Hi everyone, my name is Emily. For my nursing informatics topic, I decided to choose LifeVest, which are wearable cardiac defibrillators. Nursing informatics can be defined as a product of the scientific synthesis of information in nursing. It incorporates concepts from computer science, cognitive sciences, information science, and nursing science. It continues to evolve as more professionals access, use, and develop the information, computer, and cognitive sciences necessary to advance nursing science for benefit of patients and the profession. According to McGonigal and Mainstream, the trends toward wearable technology, smaller and faster handheld and portable computer systems, and high-quality voice-activated inventions will further facilitate the use of computers in nursing practice and professional development. It allows for speed, accuracy, and efficiency. It can support a more patient-oriented healthcare where patients become active participants in their own healthcare planning and decisions. So what is a LifeVest? A LifeVest is a wearable cardiac defibrillator. It is a treatment option for patients at risk for sudden cardiac death. It offers advanced protection in monitoring and improvement of quality of life. It improves quality of life because a patient can wear a LifeVest while doing activities of daily living outside of a medical setting. It is worn on the outside of the body rather than being implanted in the chest. It continuously monitors a patient's heart. It can detect life-threatening rapid heart rhythms and deliver a shock to restore a normal heart rhythm. So here's a picture of a LifeVest. It slips on and off like a backpack. It is lightweight, it's comfortable, they're able to wash it, and it can be worn unless the patient is showering or bathing. The LifeVest has these non-adhesive electrodes, which you can see in this picture. It looks like it's like a little purple circle. And those electrodes are on the belt of the vest, and they continuously monitor the patient's heart. The monitor is worn in a carrying case around the waist and collects electrocardiogram data from the electrodes. This information can be then sent to the doctor. If a life-threatening arrhythmia is detected, the alarm module alerts the patient with audible, visual, and tactile alarms. This allows a cautious patient to prevent being shocked by pressing the two response buttons at the same time. If a life-threatening arrhythmia happens, these dry therapeutic electrodes, which you can see here to the left on this picture, they're squared out. They will release a conductive gel before they deliver a shock to the patient. The Zoll LifeVest is a blue gel. So now that we have seen what the LifeVest looks like and what it does, I would like to talk about some client health issues. Patients should be taught proper hygiene, washing that vest every 1 to 2 days, and should look for signs and symptoms of skin breakdown on their skin. Make sure that they're monitoring for reddened areas or if they have any blisters. They should be compliant with wearing the LifeVest unless they are showering. When they are showering, they should remove the LifeVest, but they should make sure that someone is home also. So if something does happen, there's somebody there that can initiate that 911 call. They should avoid loud and vibrating environments that can possibly inhibit hearing the sounds of alarms. An example of that would be mowing the grass. The machine actually does vibrate, which is the first step in the sequence process for treatment. Patients need to be competent enough to be able to manage the equipment. They should make sure that their battery is fully charged and having a second battery on backup when needed. They should also make sure to apply the electrodes in the appropriate place and keep them against the skin. If those electrodes aren't against the skin, then the machine will alarm to tell the patient that they need to fix them. To continue on client health topics here, sensing problems could occur due to deformation of the skin and movement of the electrodes over the skin. Skin burns is a possibility underneath those defibrillation pads. Electromagnetic interference and interference from non-cardiac electrical signals can affect the sensing function. This can result in an inappropriate shock being delivered to patients. Patients' families should be educated on the device but should not turn alarms off if the patient would go unconscious. The machine does not require a bystander to operate. Bystanders should stay away from the patient because they could get shocked too. The machine actually voices out, press response buttons to delay treatment, or bystanders do not interfere. Only the patient should press those response buttons to delay treatment. Where? The four most important things for you to know. A lot of times we educate our patients with all of this information, and it's hard for them to retain a lot of that. So this acronym WHERE stands for wear it all day, all night. E, every 24 hours change the battery. A, act quickly for siren alarms. Press the response buttons. R, read the display for gong alerts and follow the instructions on the screen. So it sums up the most important information that they should remember while wearing a life vest. The LifeVest has three types of alerts: vibrations, gongs, and sirens. A vibration can be felt each time the patient changes the battery, and it indicates the beginning of the treatment sequence when a life-threatening rapid heartbeat is detected. The gong is a low-pitched sound that repeats once every second. It can be accompanied by a message on the monitor. When this happens, they should read the message on the monitor screen to decide what needs to be done. A siren is a two-tone siren which starts low but increases in volume as the treatment sequence advances. This can indicate that the life vest may have detected a dangerously fast heartbeat. If conscious, the patient must press the response buttons to avoid shock. It's important to remember to let the patient press the response buttons. Now I would like to talk about why this technology is needed. So why is this technology needed? This technology records the heart rhythms of a patient not within the medical setting. So if a patient comes into the emergency department, say they're having palpitations, chest pain, or complaints of passing out, the medical team is able to get the results to see what rhythm a patient was in at a specific time. They can either look at before, after, or the exact time of the symptoms if the patient knows exactly when the symptoms were happening. This technology also allows doctors to read in real time, diagnose, and monitor and treat the patients without being in a hospital setting. A lot of times at the hospital, when patients would come in, we would take their life vests off if they were admitted and hook them up to one of our telemetry monitors. Recently, we developed a policy where it states that we leave the life vest on and apply our telemetry monitor on top of it. The reasoning behind that is because the life vest is a defibrillator. So if the life vest's on, it can do its job properly. It can shock that patient, and it's going to do it a lot faster than medical personnel getting the machine, hooking them up to the machine, and delivering a shock themselves. Zoll, which is a brand of life vest, actually has a network, which is an online patient management system. This allows doctors to monitor patients efficiently in their practice without physically seeing the patient. They also receive notification of patient events recorded by the life vest. It provides a fast and quick resource to obtain data. It allows physicians to customize the way they view and are notified of patients' events. They can get these alerts either by text, phone, fax, or email. The electrocardiogram feature can help decide future treatment and diagnose life-threatening rhythms. It provides a trend table to see how a patient is responding to therapy during the early period after a cardiac event, which can optimize their care. It also allows for e-ordering of a life vest or to renew an existing. 1 in 14 patients require arrhythmia intervention while wearing the life vest. According to Zoll, the entire event from detecting a life-threatening rapid arrhythmia to automatically delivering a treatment shock usually occurs in less than a minute. Timely defibrillation is the single most important factor to save a patient that is experiencing a rapid, life-threatening arrhythmia. A treatment shock must be delivered within a few minutes after an event to be effective. With each passing minute, a patient's chances of survival drops 10%. LifeVest has a 98% first treatment shock success rate and a 92% shocked event survival rate. Patients either arriving conscious to the ER or remaining at home following their treatment event. Here I have included some case treatments that shows how wearing the life vest helped change these patients' course of treatment. The LifeVest is constantly monitoring their heart rhythm. So a patient who had a heart attack or an ST elevated myocardial infarct, the patient had an ejection fraction of 29%. That ejection fraction is looking at how well your heart pumps blood to your body. They also had a percutaneous intervention, so most likely taken to the cath lab, might have had a stent placed. They were having sinus tachycardic events, which were recorded by the LifeVest. Because of this LifeVest, they were able to change their course of treatment before something bad happened to the patient. Another patient who was also a heart attack patient had an ejection fraction of 30%. They were passing out or having syncopal episodes. The LifeVest recorded that they were having bradycardic events, that they needed a pacemaker implanted. A newly diagnosed heart failure patient with an ejection fraction of 20%. They were having arterial fibrillation, which helped change their course of treatment for the patient. Another patient who had dilated cardiomyopathy with an ejection fraction of less than or equal to 35%. A ventricular tachycardic event was recorded, which also changed the course of treatment for that patient. Another patient who had had a heart attack, had an ejection fraction of 30%, was having bradycardic events, which revealed significant underlying cardiovascular disease. And then a non-ischemic cardiomyopathy patient with an ejection fraction of 20%. The LifeVest had trended out their rhythms, which helped change the course of treatment for the patient. One thing that I didn't mention was that a normal ejection fraction is 55 to 60%. All of these patients, something could have happened to them, but because they had their LifeVest on, which was monitoring them, it helped them get the course of intervention that they needed a lot sooner. When it comes to the LifeVest, there are barriers when wanting to implement this. Most insurances do cover the LifeVest, depending on patient conditions and situations. Documentation must be provided to support the diagnosis and medical necessity of a LifeVest. Normally, if the patients are in the hospital, they're going home on a LifeVest, we have to send stuff to Zool, which includes a history and physical, cardiology notes. If the patient had a heart cath, we have to send that heart cath report. If they had an echocardiogram, we send all of that stuff to them so they can try to get insurance approval. Some criteria can be after a recent heart attack. Some people still need that implanted cardiac defibrillator, but sometimes there's a waiting period. So with that waiting period, we can send these people home with a LifeVest, which would help protect them if they would have a cardiac arrest. Before and after a CABG, if they're on a cardiac transplant list, if they had recent diagnosis of non-ischemic cardiomyopathy, heart failure, terminal disease with life expectancy of less than 1 year, they need an implemented cardiac defibrillator, but again, a patient's conditions delaying this or prohibits the implantation. Say they did go and have an implanted cardiac defibrillator, but they need it taken out due to infection, then we can get them a LifeVest and send them home with that. So again, a barrier is the insurance issue. There is certain cases where maybe the insurance won't cover it, a patient doesn't have insurance, or there's a copay that the patient might not have funds for. So with those barriers, we always need to have a backup plan about what we can do, what can we provide to help these patients get this LifeVest. So maybe having a program to support patients who can't afford it. Making sure that the documentation is accurate and insightful to the patient's condition, because this can result in a delay or not being able to obtain that LifeVest for them. Technology is developing and advancing every day. Although most are designed for monitoring patients with chronic diseases, they have safety implications because they can help identify early physiologic signs of impending serious health events. The LifeVest allows monitoring and intervention in their daily lives. It also provides information to medical professionals who then can respond quickly and appropriately. it's important for us working in the medical field that we're keeping up with this technology and know how to work it. With the LifeVest, it can be a little difficult because most of the time it's managed in an outpatient setting and we don't get to mess with it a lot of times. So even for us, it's important to know what this machine does and how to use it. Here are my references that I use to gather my information. I hope you guys enjoyed this presentation and learned something new about LifeVest. Thank you.